Hi, I'm Docter Boncheol Leo Goo, Chief Medical Officer of Classes. Today we are going to learn how we can use this device and how we can do the better treatment today. Ultraformer 3 is one of the most advanced and the user-convenient type of the high-focus ultrasound up to now in the market. This machine was developed to focus on certain anatomic structures like a mass, but we are extending a lot more the better indications and the better approaches to the patient's conditions. So we are going to learn and we are going to find out how we can use them properly. There is no specific contraindication for Ultraformer 3 other than the other energy-based devices. Any mechanical implants on the skin can be rigid from the surfaces or other kind of skin infections of any types. But there are some precautions that we have to be aware of. For example, anticoagulant therapies should be discontinued before the treatment, and other hypersensitivity tendencies or other kind of systemic illnesses that can affect the treatment result, and the safety should be checked before the treatment. Because Ultraformer 3 offers very precise reaching depths, it is very easy to check the nerves in the bony areas we have to avoid. For example, mandibular branches of the face or any condyles in the arms or umbilicus in the ribs and the crest in the abdomen treatment, or patella we are treating the above and the lower, the knee parts. Before we are starting to treat, we are going to find out which kind of a patient, which patient is suitable for the treatment. For many patients, we don't have much of the serious kind of contraindications, but usually the surgical contraindication is also available for this treatment. And also, if you have a specific kind of health conditions for the patients, also we have to take care of them. For better safety and effectiveness, we have to also consider about the patient selection. We have a different kind of aging process in the skin. We have sinker type, we have a wrinkler type, we have a sagger type for different kind of skin thickness and different kind of aging processes. So, for example, if we have very thin skin and a very, very bony skins, firstly, we have to recover the volume with any kind of methods. But if we have a simple sinker and a simple wrinkler, we can offer many, many good options for this patient. So for better patient satisfaction, we have to see the patient expectation and figure out which kind of approaches will be suitable for each skin condition first. Hello, 안녕하세요. Hi, Anna.
Yes,
Yeah,
that's
okay.
me.
Yeah.
Anna. Five.
Okay, Anna, we will just make some draw lines to set up our strategy, okay?
Yeah.
Okay, then. Firstly, we are going to make some of the landmarks. Is the end of the arch, the supraorbital arch, and the zygomatic arch margins. You can see down to the mandibular margins. You can see that's the line of the masseter muscles and the parotid glands on it. And you can see that the pinna and the lines here so that can be divided in two groups. So with pinching the skin, this one is much more thinner, and this one is much more thicker. So we can expect from the temporal lift to here, we can see that most of this mass at the running kind of a position. And then with the pinner to the oblique angle, the angular relief, you can just add another line. And you can see with the 2 centimeter width of the handpiece, you can see one line here and one mandibular angle apex, you can see another line from there. So we can have two different dimensions. Because most of the patient is not wanting the hollow much more prominent, we will not touch this. But if you have a sagging here, if you have wrinkles, if you have some of these textural problems, you can add some of the region here, but not as deep as like this. So we can just add them. And usually if you extend the nasolabial fold in the marionette lines, and you can see this area is some of the non-treating area with the marginal mandibular branch of the facial nerve. Right? So you can see this area can be avoided, or you can just adjust the treatment depth to avoid any the possible nerve injuries. All the same to here, you can line to go here. You can add the danger triangle here to cover the temporal branches of the facial nerve. But usually this one is running deeper than this. So if you don't touch the bone, we can adjust the skin treatment depth. Then we can just add this line differently. So we can perform the treatment very, very simply. And if you want, this is optional. And if you want to add the periorbital treatment, this is very thin skin depth. So we will just use the proper skin depth, proper treatment depth, like a 1.5 to 2 millimeter. So we can add one of the lesions here. Also, you can use the same for the forehead too. But Anna told me that she was a little bit afraid about contours of the whole skins and this nasolabial fold. So maybe we can add some of the treatment around the facial contouring margins, and we can add the nasolabial fold treatment. I think that will be perfect. Actually, it is making small dots or small bores, usually to 2 millimeter in size, in diameter, inside the skin around the 4 millimeter depths. So it is making the skin regeneration in a certain direction. So at first, calculating the total shots according to the total length is quite helpful. But if you are getting more and more the experience, you can just make a steady and a slow treatment, because the repetition rate and the treatment speed of this machine is quite fast. So you don't need to hurry, but you don't go for this as a slow and steady and very constant pitches for each lines. You can push down and you can move. You can hold the push down and you can move. Because the mandibular angle is the margins is quite sharp, the bony surfaces. So if the patient has very, very small face and a very, very bony or the skinny kind of faces, you can move the skin upward and downward. You can adjust the treatment ranges. So if you want to treat, but it's too small and too close to the bony angle, sometimes patient cannot handle the pain. So in that cases, we can just move the skin a little bit upward, like this. And you can avoid the possibility or chances to touch the bony surfaces unwantedly. Okay. For nasolabial fluid, we can just add some of the shots, not pushing down too deep because some of the patient can have discomfort on the vibrating the teeth. So in those cases, we can just use some of the cushioning gauzes inside the mouth cavity, or we can just not pushing down the handpiece to the skin too deep or too hard. You can just make a firm contact, or you can use the pinching with the other fingers, and then have the inner space with the lifted skin, and you can adjust actual depth like this. Okay. How do you feel?
Good.
Yeah. Actually, if you have the large eye bags or something, maybe we can adjust the depth, but it is just for the tightening of the skin. So we are making very, very superficial, around 2 millimeters in depth. How do you feel?
Nice.
Nice. Actually, the forehead, we have a muscle just below the skin. So sometimes the effectiveness is too high, like a buttocks.
Oh, this is nice.
Yeah. So you can just add some of the shots, but not hard, okay? And we can use this, the 2 millimeter handpiece for the periorbital rejuvenation. Firstly, if you have your patient have a ptosis, if you have a natural ptosis or the thin arch ptosis, or even with a wrinkle kind of upper eyelid, we can spread like this and touch the bone softly, and you can shoot it with this direction, not towarding the eyeball, just this direction. It's a more than 90-degree angle, so you don't have a chance to treat the orbit. So, but in these cases, we have a different kind of a skin ethnicity, and if the patient has a very, very deep orbit, you can just spread and you can shoot. That's the key point for treatment here. And we can treat the neck here, a little bit larger area, but you can go with this. Not on the center line. It is if the patient has a very thin skin, it can be a little bit discomfort. Maybe it is not supporting kind of a structure for the neck skin rejuvenation, so we can add some of the passes here and here. But your neck is very sensitive area, and also the patient can feel discomfort when you press down too much like this. So you can just make a firm contact, and you can slide smoothly. The direction is the direction doesn't matter. If you feel okay with this direction, but the device should be facing downward. So with this kind of treatment, we have initial swelling and initial redness, but it decreases so fast. And so some of the spots can be a little bit prolonged when you touch too much, when you scrub too much, when you rub too much. So you don't need to rub it, you don't need to wash it too hard. But usually this kind of swelling, this kind of redness goes away in hours.
Oh.
Okay, we are done. And how
you.
was it? How did you feel?
Actually, I was very worried on the first time. I didn't know what to expect, how would be the pain. But on the end, I couldn't feel any strong pain. It was just special kind of, sometimes depend on the part, sometimes too hot, sometimes more cooler. hard to explain, but it's very easy to handle. And it's worth it, I guess so.
Just on the line you can hold.
Yes,
okay.
exactly.
That's very good. Usually we don't have a serious complication. We don't have much of the care after that because we are not touching the surfaces. So you will not have scabs, you will not have scales or whatever. Only redness, swelling a little bit on the day of treatment, and then it can last. Sometimes it can last days, but not more. So if you feel any kind of discomfort, pain, or whatever, you can contact us. You can let us know then. And usually you can take showers, you can wash your face, you can take any kind of cosmetic or makeup. But any kind of inflammation process can happen with some stimuli. So, for example, drinking too much or anything that you're making your face swollen more, like too much of aerobic exercises or going to the sauna in hot temperatures. I think it will be better for you to avoid 4 days, okay? Thank you for getting here, and I was very, very pleased to have you.
Thank you for great treatment and give me great advice. So I'm gonna to wait for the result, and I hope it's gonna be great. Thank you so much.
Thank you.